How to set up Promerix operating table for C-arm procedures. Please note this video shows directional examples and you should always follow the instructions in the manual of the device. Trauma surgery with Promerix and the 19300 orthopedic traction device. This video will show some ways to use the 19300 traction device with Promerix and C-arm. Patient positioning should always be done by a trained healthcare professional. Always carefully follow the instructions in the manual of the device. If you have a sliding tabletop, slide the table all the way to maximize the access of the C-arm before setting up the traction device. Use leg sections to support the patient's legs during the setup. Attach the patient's feet to the traction device. Once the patient has been positioned, remove the leg sections. This is a trauma setup with both legs tracted. This position is mainly used for hip fracture patients. In this position, arm boards can be used to give further support to the patient. Note that the arms should be in a relaxed position. If you use arm boards, adjust the angle according to the patient's physique. For C-arm imaging, we recommend using a position where the other leg is lifted aside, either with a stirrup or a knee crutch. This position allows better access of the C-arm. It is also better for anatomical reasons, especially during C-arm use. Slide the table. Do the setup of the device as instructed in the manual. Here we have used a stirrup for the other leg. To support the patient's upper body, use lateral braces. The bigger the patient, the more important it is to use this kind of braces. With the braces, you can adjust the positioning of the upper body depending on the area that needs to be operated on. Arm boards can be used on the other side. This position provides good access for the C-arm. You can now take necessary images of the operated area. You can also easily adjust the C-arm angle between the shots. For better access to the upper femoral area, the upper body can be slightly tilted and moved towards the opposite side of the table. Use lateral braces and arm boards to support the patient properly. This position provides good access for C-arm shots of the upper femoral area. The same approach can be used for patients of different sizes. The previous case handled a 50 kilogram or 110 pound female patient. Here we have a 100 kilogram or 220 pound male patient in the same position. The bigger the patient, the more important it is to use accessories giving support, such as lateral braces and arm boards. The C-arm can easily access the operated area for imaging. In this position, we have used a knee crutch instead of a stirrup. Here you can have the same procedures as when using a stirrup. The C-arm can easily access the operated area for imaging.